Welcome back. February is Heart Month, dedicated to raising awareness about heart disease. And here to tell us more about the signs and symptoms and things that we can do is Dr. David Wiseman at Jupiter Medical Center. Thanks so much for being here with us. I know we want to talk about a unique method that you use also. But first, can you just talk to us a little bit about what heart disease is and what we should be looking out for?
Yeah, I mean, heart disease obviously is really important. It encompasses really a whole host of different problems. When we think about heart disease, we think about some different categories and things like blockages of the heart vessels and or peripheral arteries. We think about failing of the heart or heart failure where the pump doesn't pump right and we may fill up with fluid. We also think about other things like rhythm-related disorders. Obviously, that's my specialty.
So one of the things I know that we talk a lot about during Heart Month is knowing your numbers, knowing what your blood pressure is. So that's a really good indicator and maybe even way to prevent it before it becomes something more serious.
That's exactly right. So, that's part of our kind of modifiable risk factors. We want to keep our blood pressure under control. We obviously want to watch our weight, check for things like our diabetes and fasting blood sugars. Those are all the things that can contribute to the advancement of heart disease.
Dr. Wiseman, so you are known as the electrician of the heart. Can you talk to us about what that means and what exactly is the method that you use?
Right. So I'm a cardiac electrophysiologist, which just makes me a heart rhythm specialist. So patients come to see me for my expertise in that field. I do a lot of different procedures, including things like ablation, which is a way to treat different heart rhythm disorders. Typically, when you go to someone like myself, they may use something called cardiac fluoroscopy, which is really a fancy term for X-ray or radiation. And we all know about the effects of radiation and why that may be bad. And over the last decade or more, I've developed varying procedures and ways of doing these ablations without the need of fluoroscopy, just utilizing special 3D mapping techniques and ultrasound technology.
So we're using less radiation then?
We're using no radiation.
No radiation.
Even better.
Okay, so no radiation at all. All right. Okay. Now, when you're talking about the heart rhythm and that you're tracking that, what causes that? What should we be looking out for when it comes to that?
Right. So patients typically come with things like palpitations, feeling like their heart is racing. They may feel short of breath. When they go to exercise, they may feel like their heart is just pounding out of their chest, and they may even feel faint and actually pass out.
Okay. Anything else you want to add, Dr. Wiseman, before we let you go?
No, I mean, I think if you experience any of these kinds of warning signs, the most important thing is to check with your doctor or cardiologist or someone like myself.
All right, perfect. Thank you so much for being here. And if you want more information, if you want to watch this interview or know more about from the American Heart Association, we put that link on our website, WPBF.com. Just go ahead and search continuing coverage of Heart Month. Thanks again, Doctor, for being here. Sandra, over to you.
Yeah.